Yeah, sir, we are live on Facebook also. You can proceed.
Okay. Welcome everyone. We heartily invite all the audience. We logged into our program, and we thank both the senior faculty, Dr. Venkatramana sir and Dr. Subbareddy sir. This interview is a special session. It is a first of the kind of interview as a part of the series which we aim to do from IDCCM Hyderabad. So these are basically intended to to help the students who are preparing for the examinations, who are into the critical care, who want to train themselves more. So we started a student corner as a part of it, and this is an examination section. Today the interview would be about what the examiners actually expect from the students who are appearing for the exam. Here the exam particularly we are talking about is IDCCM practical exam, Indian Diploma in Critical Care Medicine by Indian Society of Critical Care Medicine. We all know that the theory exam of IDCCM is over, and now the students are going to appear for IDCCM practical. So we thought we'll get together two senior examiners and faculty so that they'll impart their knowledge and their experience, so that it will be helpful for you in your exam. Welcome Venkatramana sir. Thank you for joining us. Venkatramana sir is the head of clinical director and head of critical care medicine from Yashoda Group of Hospitals. And his sir is also a national executive committee member from IDCCM, and he has been a senior examiner at various levels. Welcome, sir. Welcome, Subbareddy sir. Subbareddy sir is the head of critical care medicine and regional director of critical care medicine for Apollo Group of Hospitals, Hyderabad. And sir is also a chairperson of Indian Society of Critical Care Medicine, Hyderabad chapter. Sir has vast experience of being an examiner at various levels of critical care medicine exams. Thank you, sir.
Thank you, Dr. Deepak. You introduce yourself also.
Thank you, sir. Myself, I am Dr. Deepak. I would be the moderator for this session. I am a consultant in critical care medicine, and I am also an executive committee member from Indian Society of Critical Care Medicine, Hyderabad. So right now we'll be directly going into the topic. Venkat sir and Subba sir. So I'll start with Venkat sir first. Sir, we know that the IDCCM exam, practical exam is around the corner. When are we expecting the exam to be conducted, sir? Sir, unmute yourself, sir.
Thank you, Deepak and IDCCM Hyderabad chapter for this student-friendly initiative. It is a much-needed one. We would have been dreamt this kind of programs during our studentship days. Anyway, nevertheless, you initiated it. Coming back to the question of this session's IDCCM exam, which is scheduled to be on 16th and 17th of April. The students who appeared on 4th of March, I think we expect their results in another week time, and followed by next month, 16th and 17th will be their practical exams.
Okay, sir. The next common question most of the students are actually asking is, would it be an online exam or offline exam?
See, for the last 2 years, because of the pandemic, IDCCM leadership and the college board could I conduct this exam online. I think on this session also, the exam will continue to be online, but I think we have to wait for the official announcement to the students and all teachers. At this point of time, we believe it will be online because of the wandering of this pandemic in and around, and a very short time left. So we hope that this will continue to be online this time.
Okay, sir. So Subba sir, what would be the basic difference between the offline and online exams?
Yeah, first let me thank IDCCM Hyderabad for giving us this opportunity, and thank you, Dr. Deepak, for moderating this session, and thanks to all the students who joined today. If you have any students, if you have any questions, you can put it in the chat box. We will discuss those questions also. Coming to your question, Dr. Deepak. So what is the difference between the previously physical exam and now we are having the virtual exam? Physical exam, there are a few centers in the country. We used to go to, when I was giving IDCCM, I have gone to Pune. That time Hyderabad was not the center. Now Hyderabad is center, Pune, Chennai, all the metros we have, and Calcutta. So, and then if you are your own institute, you will not get the center. You have to go to some other institute and then you have to give the exam. and you have to travel one day before, and then you have to do one recce to the exam center. Where is the exam center? Where is the ICU? And all you have to go and see, and you have to do some recce. But for the online exam now, it is very comfortable for both examiner and for the student. So examiners need not travel and students need not travel. And like excellent coordination by the IDCCM, that IDCCM, Indian College of Critical Care Medicine, and the execution by the Indian College of Critical Care Medicine is also excellent. They're executing now these online exams. First, they have done because of the pandemic. It was like initially we had doubts how to conduct this online exam, and then after 2-3 workshops. In fact, if I remember Apollo, we did F&B workshop online, and then a lot of national leaders were asking us, how did you find this online exam? What are the glitches and all? So basically the glitches are like, there are glitches also, like you need good internet connectivity for your online exam. And you have to sit in a room which is silent, and then good internet connectivity. And then you have to keep everything next to you, your ID card, and then your hall ticket, everything. And otherwise, and then like in the physical exam, you will have, I think, more interaction with the examiner. Day-long exam, morning to evening. So you will have interaction with examiners multiple times. But in online exam, there's no break. And then at a time, like you have to take both the cases and stations. And I feel I have given a physical exam, and then I was examiner for online exams. I personally felt this online exam is very easy, and passing is also, I think, good. So there are a lot of differences, but I think these online exams are comfortable for both examiners and students.
Yeah, so basically when it was on physical basis, before this last 2 years of pandemic, the exam scheduled to have 2 halves, the morning half and the afternoon half. The morning half used to have the 2 case presentations, which usually consist of 40 marks each of 80, and followed by afternoon sessions of around 5 to 6 stations, which consist of around 120 marks. So this was a long day exam, and now online, you will not have breaks between cases or the stations, and it will be a continuous 45 minutes exam. And this 45 minutes exam will be divided into 3 components, 15, 15, 15. So the first 15 minutes will be case 1, followed by the second case, that is another 15 minutes, followed by the stations of 15 minutes. And the mark distribution has also been changed from the 200 marks earlier. Now the total marks has been laid down to 100, total of 100. And each case consists of 25, and followed by another case, that is another 25. So altogether 50. And another 50 marks consist of the stations. Those will be around 5 stations, and these will go through a slides. So earlier, each station used to be a separate, and the students used to spend around 10 to 15 minutes in each station. Now there will be one single go where all these exams, case 1, case 2, followed by stations, and you need to attend this all together. So this is a new change. And earlier, each case used to have one initial vignette, which was actually given to a student, and they will get a time of around 20 minutes to prepare for it. Whereas in online exam, you will not have that kind of options of preparing and all. You will have the first vignette where you will be given a clinical scenario, and you have to read the clinical scenario, or your examiner will read the clinical scenario, followed by the basic questions to that. And then there will be another vignette followed by. So there will be a total of 2 vignettes in this online exam. Whereas in offline physical exams, we used to have a 4 to 5 vignette, 4 vignettes. One vignette is the starting vignette, which a student gets before he comes to the examination room, followed by another 3 vignettes during this examination process. So it made, as Subha said, as an examiner, I felt because of the pandemic, the IDCCM examiners and the college board felt all the students would get benefit of this effect of the pandemic, and they made it more comfortable to them. But in the meantime, they tried to maintain the required regular standards so that the examiners can assess whether the student is really worth of passing or not.
Thank you, sir. just for the, as I think Subhas have told, for all the audience, if you have any doubts, just put a question in the chat box. So we'll be taking it in the end or whenever it is in this one, instead of interrupting the flow. So going back for a second, sir, Venkat sir, as an examiner, what are the instructions you'll be getting from the ISCCM? How do you prepare yourself? I'm like just a candid chart. What are the instructions and how many examiners will be there on the exam day? Can you just enlighten us, sir?
See, as an examiner, see, it is not like that kind of an open exam which we get during our post-graduation days, where the examiners have a freedom to select a case, the examiners have a freedom to select the questions, and there will be a lot of variability between the question pattern. But the IDCCM exam is more structured nowadays. So I mean to say structured is the all students who are appearing will get a uniform pattern, if not the same case, but uniform pattern of Vignet. So we get instructions that these are the cases which you will get a PPT a few hours back before. And then these Vignets need to be projected to the selected students. The initial 2 students get one kind of case, and followed by another set of cases to another set of students. And each set of students, for example, 2 set of students will get the similar cases, and probably the followed by the stations also. And these will be followed by the Vignets also. The Vignets will be following in the same way. So as an examiner, we get instructions of a structure, and the questions and the flow is already fixed. So we find these exams to be more uniform, more structured and unbiased, and not varied with examiners.
Right, sir. The objectivity is the one which I think.
Yes, I agree with Dr. Venkat. So ISCCM has taken care to remove this examiner's bias. So that's why they give a structured case, and the questions are also same. To prevent this examiner's bias, I don't have freedom to ask any question. See, you are uniformly assessing the students. So they will give fixed vignettes, case scenarios, and then we'll be assessing the students. And to avoid the bias, there are 2 examiners again. And we have to see, we coordinate with each other how many, how we are marking and all. The other thing is, if your students, ISCCM will make sure that your student will not be, will not come when you are taking examiner. Some other examiner will assess your students. Online also, they make sure that, and then you have to, when they give, when they send us these marks sheet, in that they will write. So if your student is there, we have to inform, and then later we have to we have to sign saying that my student has not given exam with me. And the other important thing is the examiner, they give instructions to the examiner to write down the reasons for if the student is not performing well, or if you are failing a student, you have to write in the remarks. So that we need to write, and then we need to submit to the ISCCM why we are not able to give full marks for this student. Right. That is the important instruction they give for the examiners.
Right, sir. So I think for the students, it is pretty clear that it's a very objective way of assessing the students. And at the same time, it's an impartial way where there's no conflict of interest as well. Thank you, sir. Going into the first head or the clinical case scenario, Subha sir, how would be the cases will be formatted? How will be given to it, and how are the students going to be assessed on the clinical cases?
Yes, first of all, they will not give any rare case. You will not expect a rare medical case with a difficult diagnosis and all. So if you look at the cases, we know what cases we are going to get. If you look at the respiratory system, we know we have one ARDS, one COPD, bronchial asthma. We don't have too many cases. They will not ask ILD unless very rarely they may ask, but regularly these are the standard questions. If you look at the neuro, again, the cases are standard. So they give the case scenario. Based on the case scenario, they give, like Dr. Venkat said, when you're giving a physical exam, you will have 20 minutes time to go through the vignette, and then they will give questions one after the other. In the online exam, so the examiner and the student will be reading the case history at the same time. And coming to diagnosis, as I said, we will not get very rare medical cases. So the diagnosis is very, very important. And then if you get a case of ARDS, and then they will ask you what is Berlin definition for ARDS, and then how do you proceed with the ventilation, antibiotic prescription, all standard questions. And in the Vignet 1, that is that gives around 15 marks. As Dr. Venkat said, each case the student will be scoring 25 marks. First Vignet 15 marks and the second Vignet 10 marks. In the second Vignet, when they go to the second Vignet, so first Vignet you will have all basic questions and then basic critical care aspects, and then you have to clear though, you have to answer clearly. Then we go to second Vignet. In the second Vignet, we get little more advanced questions. So they try to cover almost all the systems. If I get an ARDS case scenario, then they will try to take you through the urine output dropped after your ventilation, and then
I think there is a break in internet.
I think from
So,
Subha sir,
so actually,
we can take it.
As
Sir has joined.
Subha was explaining, the question which some of our students also asked, the cases which will be a part of your exam are routine intensive care cases. So it will not be a rare case. Every day in and out, what are the cases you see, like a community acquired pneumonia, ARDS, a sepsis, a pancreatitis, a polytrauma, a obstetrics emergencies, which comes to the ICU, a poisoning. So even sometimes when you get a case like an immunocompromised host or a transplant or a post-transplant situation, don't get over apprehensive by those terms of a post-transplant or a immunosuppressive post-chemotherapy patient. It is just to give a clinical context. But again, the exam will be more based on your critical care related knowledge. So these are all regular routine critical care cases which actually are routine in your ICU. And again, my suggestion will be prepare all common routine cases which you come across in your ICU. Okay, sometimes you may not come across cardiac cases. Your ICU may be purely a medical, but make sure that you are also covering them. Also, make sure that you are covering obstetrics. Some of the hospitals may not have an obstetric cover, so they may get these cases as a very rare or temporary. Sometimes a trauma may not be a common component. Make sure that you're covering trauma. Intoxication being a very rare in metro cities, it is more common when a rural population flows to you, like OP poisoning and all. And corrosive acid injections like a toilet cleaner, or those are more common in intensive care setting in a metropolitan cities. So, but you may get a case of OP poisoning in your exam. So even though those cases are not common in your ICU, but they are all routine common cases in critical care setup. So make sure that you are covering all those spectrum of cases. Don't prepare a set of cases, because that will keep you guessing if a case comes out of that box where you stand. So you prepare and make yourself available for all possible cases which may come across in your date. And second, I think what an examiner expects. Suppose as an examiner, what I expect you out of a student when I actually take the exam. My first expectations will be whether the students, if I give a degree of diploma in critical care medicine after a post-graduation, is he safe enough to practice a critical care medicine in intensive care unit? Am I giving a safe certification to him? That will be my first question to my mind. So I will expect him to do the basic standard of care right, not getting diverted from the basic standard of care, and followed by additional probably all added recent advances. So as a diploma in critical care course, we do expect a year of fellowship course after a PG. You need to know all the basic standard of care. Okay, the basic regular common practices, standard practices across the world, and common guidelines which are practiced across the world. You may not maybe follow all the recent advances, all the recent review of literature, but the basic practices need to be on the front. As Dr. Subbareddy explained, now in online exam, we have two components, the Vignet 1 and Vignet 2. Vignet 1 includes the basic critical care. It has been given 15 marks out of 25. And in this basic Vignet, you are expected to answer all the basic questions. So it is given to you to make sure that you are performing in that basic Vignet well, and you are clearing the exam. The second Vignet, which is the Vignet 2, which carries 10 marks, are additional Vignet, where if you perform well, you will get more marks to score more marks. Your additional knowledge will add up to your marks. The first Vignet is the basic Vignet, which will consist of the basic critical care.
Thank you, sir. The point is pretty clear that I think you should cover all the breadth of the cases. You should be prepared for all the common cases which you encounter in the routine ICU. And the examiners wants you to be passed as a safe intensivist. That is the first point. Sir, again, the same question for you, sir, Venkat sir. What are the common mistakes you observe students committing in this cases section, head 1?
Yeah, so when you get a clinical Vignet, so most of the times what I observe is the specialty guys, like one of the specialty may be from pulmo, one of the specialty may be from anesthesiology, one of the specialty may be from medicine. They may not always get a case of their comfort. Suppose they get a cross case, most of the times I see they get panic. So my sincere advice to them is, first prepare yourself for all the horizon of the cases. You're good at your primary department. You also make yourself good in the other departmental cases. For example, a poisoning, a trauma for a pulmonologist, acute pancreatitis for a pulmonology fellow. So what I mean to say is, you may be having a primary degree from one department, but when you come to the critical care, you need to know the whole spectrum of critical care. You cannot actually stick to one. So what I observe is, when a particular postgraduate gets a case out of his comfort zone, they get a lot of apprehension, they get anxious, and then they initially kept in the mind that probably I have not prepared this case and all. And sometimes when they get a case of like a post-transplant, a poisoning or a polytrauma or a cardiac case or a obstetric case, they always feel okay, I have not prepared this case. So there is nothing like not prepared. If it is a routine case of your ICU where you have managed all the width and breadth of the intensive care, this will be again another straightforward case of critical care. Mind you, most of the questions which will be asked to you in any of these scenarios will be linked to critical care. That is resuscitation, stabilization, optimization, evaluation, and caring. We will probably not go into the details of transplant related complexities or oncology related complexities or obstetric related issues. We will be dealing with the critical care. So don't get panicked by just the name of post-transplant, post-chemo, or a trauma, or just a word of obstetrics. So just read the case carefully with a calm mind. Make sure that you are understanding the case and the diagnosis, and then you follow what you do in your ICU in an appropriate way. So my first suggestion is, the moment you see the case, don't get panicked by if you don't know. If you know the case, you are well and good. Second, once you read the case, the diagnosis of all the cases, whatever we see in most of our exam scenarios, are straightforward, Deepak. So we don't find any student fumbling with the diagnosis, because it will be just given to you. For example, you will have a case with amylase lipase of 8,000 with an abdominal pain. You straightforward, you know it is an pancreatitis. So that's not the thing which we like to test from you. What we wanted from you is, you diagnose as an acute pancreatitis, then what are the other possibilities in this scenario? So how widely you're thinking, and how you are actually confirming your diagnosis, whether it is an acute pancreatitis, and how then you are managing this. Similar way, if a patient comes with a sepsis case, which will be clear again, a community acquired pneumonia or another foci of infection, the examiner will ask, what is this case? Or sometimes, what is your provisional diagnosis? Then they will ask why you say this is sepsis. So he has to substantiate, rationalize why he is saying this is the diagnosis and why he is saying this is not the other possible differentials which are not possibly the cause. Or sometimes they may say these are my 1, 2, 3 diagnoses and probably I will investigate in this way to differentiate between them. And most of the times the initial vignette will stick to the basics like why are you saying this is a sepsis? So we expect them to say probably there is a focus of infection, either suspected or confirmed, and that has led to organ dysfunction because of any dysregulated host response. He may answer by a sequential SOFA scoring, or he may say these are the different organ dysfunction. So these are the basics we expect out of them. And then we also expect them to talk about when it comes to resuscitation, when it comes to the management also, the basic things first. For example, in a sepsis case, we expect them for a volume resuscitation, airway breathing circulation stabilization, and probably a vasopressor requirement to maintain a mean arterial pressure, and a set of appropriate cultures, either a set of blood cultures or appropriate other cultures, and giving an antimicrobial, appropriate antimicrobial at the earliest. These are the initial steps which we expect. But what happens sometimes, being little out of fancy, some of the students start telling me maybe I will do a procalcitonin to diagnose this as a sepsis. They will go a little away. So the examiners want the basic things to be done, the standard of care to be done first, and followed by, as the case gets deep, and you may probably add on your knowledge.
Thank you, sir. Students, again, the point is basics, and basics. And you no need to panic if you see something abnormal, like very rare diagnosis. The intention of the point in giving that case is again to test your basics again. So the question to Subha sir, in this head 1 section, how is the better student and an average student? What are the scoring points actually for the students?
Yes. In the section 1, when you are assessing the case scenarios, so as like we were discussing, it is not difficult to diagnose. Diagnosis, everyone will do ARDS or COPD, or you are talking about head injury, stroke, like we diagnose. And then in the first vignette, you'll be having 5 questions, all basic critical care concepts. And then you have to articulate properly when you are there's a difference between a average student and a good student. Average student, you have to give a lot of clues to extract the answer. A good student, the flow, they maintain the flow. And if you get a trauma case, so when you're talking about a trauma case, you will tell according to ATLS protocols, I'll follow the ATLS protocols. According to ATLS protocols, I'll do this. If I'm talking about sepsis, according to surveying sepsis guidelines, these are the resuscitation, how to how I identify septic shock, and then how I do resuscitation. And next, vignette 2. Vignette 2, there are little advanced questions. So when you are talking, when you are giving answers, if you are able to tell the clinical trial, the evidence for that, see, you are giving a post-MD exam. So you are more matured, you are not giving MD exam. So when you are answering, your answer should be like a matured answer. So if they ask you, how do you manage cardiogenic shock? You will be telling, I'll be optimizing preload, afterload, and then I'll be improving the contractility. And then you have to answer. It's not that you will be you'll be telling, okay, I will first of all, you take some time to say cardiogenic shock, and then you say, I will try fluids, I'll try vasopressors. Like they should not talk like this. You are giving post-MD exam, and then you should not do blunders. First, you should not tell any answer which is causing harm to the patient. And then when you are answering the basic questions, and then if you tell the evidence for it, when you're talking about proning in ARDS, if you talk about the recent meta-analysis, PRO-SEVA trial, the examiner will be impressed. If you're talking about refractory ICP in head injury, what is the next level management? When you're talking about rescue ICP trial, when you're talking evidence for decompressive craniotomy, that then they will know that this student knows with evidence. So that's how they score more marks. And then you should not get depressed when you are not doing the first case, you did not do that well. And then you should not get depressed. And then you have a second case to score. And then we take aggregate. And then sometimes students, they do very well in stations. So when you take the overall marks, some students, even if you don't do good in 1 or 2 stations, or in one case, in one vignette, if you're not done well, but in other vignettes, if you score well, still you get higher marks, and then you will get more you will be the better students, and you will pass with better marks.
Thank you.
The other important component, Dr. Deepak, is see, we have total 25 minutes for this case, and 15 minutes for the first vignette, 10 minutes for the second vignette. And in the first vignette, as Dr. Subha mentioned, there will be 5 questions. So as you asked, how a student can fetch almost full marks or better marks is, see, you have a limited time of 15 minutes. That means each question, including the question and answer, will have 2 to 3 minutes with you. Okay. When a question is asked, be very careful, listen to the question carefully. Okay. And be very precise when you answer. Okay. Answer to the point. And as Subha pointed out, give adequate rationale why you are answering, or if you have any strong evidence suggesting it, which is there with you within your mind, please mention it. So that is very important. Suppose what happens in a average students or a borderline students, we struggle to extract those answers. We try to give a lot of proactive hints, trying to give clues. We try to, when they go here and there, we try to bring them back, and again try to see. This will actually cause a lot of lapse of time. And IDCCM don't allows you to spend more time. If 15 minutes is over, you have to switch to the next slide. And if 25 minutes is over, you have to switch to the next case. So if a student is stuck in the first 2 or 3 questions, so other questions are remained unquestioned or unanswered. So there, see, each question is of 3 marks. If you have only been appearing around 10 marks or 12 marks, how do you score pass marks out of them? So you have to be mentally prepared when a case comes. So these are expected questions. So these are the precise answers. And if suppose you don't know anything about one particular area, so sometimes it is maybe safer enough to say, probably I don't know this, sir, so that the examiners will go to the next component, or you may request for a clue, or you may ask something to the examiner if you wanted to. So you have, as a student, you have to keep that in mind. You do not have an unlimited time frame. You have a fixed time frame.
Within this 15 minutes, sir, can they go back and again answer the previous questions?
Yes.
Can they change the answers?
All the examiners are very kind enough. Sometimes when actually they ask, can I go back to the my case scenario? So most of the times we do agree or honor their request and go back to the case scenarios and give them the initial slide when these questions are on the second slide. We do that, and we do see. All the examiners want the students to be passed. They are there to make you pass. You have to just pull out of them. We are there to help you. We want you to perform well. We want you to do well. So be in the positive frame of mind. I can vouch you. All the IDCCM teachers are in a positive note to help all the students out there.
Thank you, sir. Subha sir, next question to you. Before we move on to the head 2, that is the stations, anything to add from you, sir?
Yes. As I said, we have to concentrate on both cases and don't waste time. And then if you waste time, and some vignettes are very long, so some cases are very big cases, and then time consuming. and like you will get one case like that, and then the other case may be very short, like a stroke patient came and then thrombectomy done, and then after that they go like the next vignette they go into brain death, and then they will ask you the legal aspects and then the medical aspect, ethical aspect. So you can you can save time in the second case. So but try to finish your case, first case and second case within time. Try to answer all the questions. Some people, they will like after first vignette only we have to stop because the time will not be there. So try to cover all the questions so that you will answer some questions, and then you will score more marks. That is the advice for the students.
Do they have any way of practicing this before the
Yes,
actual?
they have mock exams and then conducted by IDCCM, different branches of IDCCM. They conduct IDCCM mock exams. So if you attend these mock exams, if you practice, it will be easy for you how to answer. And then in the mock exam, all seasoned examiners, they will give training to you how to answer. They debrief at the time and after the mock exam. So one way is attending mock exams and then asking your seniors, asking when you are like, if you do your honest work in ICU for 1 year in IDCCM, if you work honestly in any good intensive care, and then you will definitely pass the exam. But some cases like burns. So in my hospital, or in your in some hospitals, you don't have the burns unit. So they have to go for burns training in different hospital. In our hospital, we have DRDO Apollo has burns unit, but you have to go there and then you have to see the burns patient. So you need not you cannot say, no, I didn't see the burns patient. So you can read and then you can go and see the burns patient. And then sometimes obstetric critical care. You may not get a lot of obstetric patients, but still in the exam, you should not struggle to answer. So these are some cases, if you're not seen during your training, try to go for that posting, see the patients, and then you can read, and then you can discuss these cases more in your classes.
My add-on suggestion would be, you may not always get a mock exam. So I request all the students, they will have their own teachers in their institution. Also, they will have the regular examiners in their own city. Okay, take help of them. Go and present whatever case you are not confident enough to them. Okay, and most of them will know what is the exam pattern and how the examiners examine. So there you will get a kind of hands-on practice. And the other best option is your seniors. The recently appeared IDCCM student who were seniors last year. So go back to them and probably present your case and ask them how was the examination pattern and what is. So these are the two easiest ways: your own teachers, your own senior colleagues who actually appeared the exam and cleared, and probably the examiners. If you already have examiners in your city, you can go back to them and present your cases. So it should be a routine practice. You should not just prepare for the exam. It should be day in and out practice, that when you actually take rounds, you present your cases, try to interact with your clinical in the clinical rounds with your seniors, with your teachers.
Thank you, sir. Moving on to the head 2, Venkat sir, how would be the head 2, the afternoon stations which used to be in the actual exam, physical exams? In the online, how are the stations formatted? How would it start actually, head 2?
See, now also the 2 parts are separate. So all the students need to understand that the case scenarios, which will consist of 25 marks each, in both together, they have to pass separately. That means out of 50 marks of 2 cases, 25 plus 25, they have to score 25. That is 50% together. They may score 1 more or 1 less, but together they have to pass 25. And similarly, another 50 marks has been given to the stations, and they have to score 25 marks. That is a 50% out of that 50 marks separately, and then combinedly they have to again clear with a 50% mark. Now, as Subha pointed out, don't get disheartened by just one case you have not done very well. So most of the times we see that happening, Dr. Deepak, they get completely down, very low. They start getting completely block out. Okay. But in fact, we have seen students who have done miserably very bad in one case because they have not seen that case, or by some bad luck, they have not gone through that case appropriately and they got stuck. But the second case which they come across, they did extraordinarily well, and overall they just need to score 50%. Even though they scored 40% in the first case, if they just score 60% in the second case, they are passed. So what I suggest or recommend to most of the students, and don't get disheartened because of one of your vignette went wrong or one of the case was not that great. Till your exam is over, keep your spirit on, keep your motto on, so that you have all reasons to pass those exams. And don't carried away by one examiner. See, to actually avoid the bias, the two examiners were placed to assess you. If one examiner also is not being very convinced about your performance, there will be another examiner. If he feels that you have done a reasonably well, so they interact and probably they get convinced with each other. Probably you have done reasonably okay to get passed. So keep your hopes on till your last minute of exam, till your results are on. I have seen many students who came back and told, I have done miserably very bad, but I saw them pass. The reason is that they have done miserably bad in one situation, which was very probably coincidentally unfortunate, but they have done well in the other stations which have scored. Coming back to the stations were used to be almost a half a day program in physical exam. And each station used to be around 15 minutes. And there used to be around 6 stations consisting of 20 marks each of 120. But now that has been concise to only 5 slides. Okay, again, I'm repeating, the 5 stations are 5 slides. And each slide is 1 station. And this whole 5 slides will be dealt in 15 minutes. That means each station is 3 minutes. So each station will consist of 3 to 4 questions. For example, you have an airway system. So you may get a LMA image. And related to the laryngeal mask airway, you may have 2 or 3 questions. Indications, okay, where do you use and what is the amount of air need to be inflated? What are the common usage in your intensive care unit? Okay, what are the disadvantages? Something like this. So you will, that is your airway station. That how it has been shrunken or concised. In the same way, you will have an image of drug. Okay, and that drug, you will have 3-4 questions related to that. So that is a station to your drug. Okay, in mechanical ventilation, you may just have a graph. Okay, and that graph will consist of 3 or 4 questions related to that graph. So in the similar way, the whole stations has been placed in 5 slides, and these 5 slides will go, each station, each slide will be 10 marks, 5 slides, 50 marks. And you have to score 25 out of these 5 slides or 5 stations. And one is ACLS. One among them is ACLS. And you have to pass the ACLS. Suppose you do very well in your cases, you do extraordinarily well in all the 4 stations, and you scored aggregately also more than 50% in cases and in all the stations, but you failed in ACLS, you are failed in exam. Earlier in physical exam, airway assessment was also a component of mandatory station pass. But now, because in physical, it is difficult to assess the airway assessment or airway management assessment. So they have taken out that, but ACLS still remains to be a component. You have to mandatorily pass ACLS.
Thank you, sir. Subha sir, can you just go through us each station and let us know what are the common mistakes like students generally tend to do?
Yeah, like Dr. Venkat said, we have 5 stations, and each station we have 10 marks. Before in the physical exam, now like after this pandemic over, then again you will have a physical exam. So these first we'll take the airway station. Airway station in the physical exam, they keep the mannequin and then they keep all the airway equipment, and then they will ask you to show or demonstrate how to hold the mask, and then how do you intubate, and then they will try to assess your airway skills practically. And if you don't know how to manage the airway, so then you cannot work in intensive care. So again, in a physical exam, both airway station and ACLS both are very, very important. If they fail in airway or ACLS station, then they, like, even if they pass in other stations, they will not be allowed to pass. So when it comes to the online exam, when it comes to airway station, they will show you a picture of LMA, and then they will ask you to identify, they will ask you to like endotracheal tube, and then they will ask you the different parts of the endotracheal tube, and then laryngoscopes, different laryngoscopes, and then they may ask you about the humidification system, these things. And then recently, because of the COVID pandemic, you cannot go with just like I read everything about COVID and then I don't know anything about non-COVID. People, when you keep the humidifier in exam, and most of the people, they were answering HFNC. So, so that is the basic mistake they were doing. So in ACLS, when it comes to ACLS, and then if you can't identify this hyperkalemia ECG, and then if you can't identify ventricular fibrillation, or if you're not able to, if you're taking time to identify ventricular tachycardia ECG, some basic ECGs, and if you don't identify, or if you are struggling to answer, then it is difficult to pass. So ACLS and airway both are very, very important to clear, and these are easy. And I suggest all the students, if you attend mock exams, and then if you practice these stations during your mock exam, it will be easy to pass. Coming to the drug station, that is the third station. In the drugs, they ask you about the cardiac drugs, they ask you about antibiotics, they ask you about sedation, anesthesia drugs, and antifungals, antibacterial drugs, and all. So, and then the fluids, they ask you about the fluids. And again, I'm telling you with what background you had before taking up this IDCCM course. If you are pulmonologist, you'll be concentrating more on airway, because you will try to do mistakes in airway. And if you are a physician, internal medicine physician, again, you need to concentrate on airway. They will be struggling to show the airway skills. So, and then if you are anesthesiologist, then you will be struggling to answer some antibiotics, and then the investigations and all. So regular antibiotics, carbapenems and polymyxins, all these things you should answer, and antifungal, regularly used antifungals, without struggling, without taking many clues, you have to answer. In the online exam, they will ask you drug, they will ask you heparin and low molecular weight heparin, and then the differences, or they will give you heparin, and then how much dosage you give, and then how do you monitor, what are the indications for heparin. So 3 questions they will give under one drug, and then you need to answer these 3 questions. And most of the time they ask you about the mechanism of action also. And coming to investigations, again, you should not take more time, because people will be taking more time to look at the investigation session. And you have these ABGs, and then you have X-rays, and then you have CT chest, you have CT abdomen, CT brain, and all are standard imaging. And they won't keep any complicated rare diagnosis, and it is very easy and in the investigation station to score. Sometimes people will not identify even pulmonary thromboembolism in a CT chest, saddle thrombus also they try to miss, and then examiner will have difficult time to pass these people. And mechanical ventilation and hemodynamic monitoring, again, this hemodynamic like arterial tracing, CVP tracing, and then the mechanical ventilation waveforms, you have to be thorough, and you cannot afford to do many mistakes there, otherwise again difficult to pass. So these are the important aspects when it comes to stations. Thank you.
Venkat sir, anything to add about the mistakes, and how would be the scoring points? How do the actually candidate scores more and become a brilliant student?
In physical stations, when we used to have physical stations for this EA, we used to have 3 components to them. One was essential components of a particular airway skills. These skills are essential. Without those skills, the student will not be passed. For example, inline cervical spine stabilization, of a oropharyngeal airway placement, or a endotracheal intubation techniques, mask ventilation techniques, and all. Then there was another component after that called advanced things, and there was some things, additional things. So these are the 3 components in a physical exam, when we used to have these physical exams, which used to carry 20 marks. Now the whole together is 10 marks. Okay. In those 10 marks, now what happened, it is a rapid fire round kind of thing. So you will just will get an image, you will get a 2 or 3 questions related to that. So most of the times what happens is the student tries to answer the things around that particular image. So it is not required. So my recommendation or suggestion will be, read those questions carefully, or those questions will be read by your examiner. Listen to those questions and answer those questions appropriately. For example, it will be written, identify the image. So you say laryngeal mask airway, you get those marks. Then they will say, identify or tell the indications of laryngeal mask airway. You have to say where you will use in laryngeal mask airway in your IC. So you be precise to the question which has been asked. Suppose in extreme condition, the one common thing I wanted to say is, most of these images, most of this information which will be asked in these stations are very, very simple and routine and common practices in your ICU. You don't need to worry about something which you have never seen or never been using, and that will be a question. You will get a HMA filter, you may get just a graph of a regular volume pressure loop, or a scalar of a volume time, or something like a you may have a airway trapping or a air leak, something. It's very, very similar things which you day in and out get in your ICU. So that will be as simple as that. So you be very precise and try to answer them appropriately, rather than trying to talk about it very. Suppose by some wrong reasons you don't know a particular thing. You came across a particular image in one of the stations where you don't know. Okay. So you always can say, go to the next questions, not wasting time. And when you have a time, you always can come back to that station if at all you have a time. So these are the things which need to be focused. And as already been emphasized, I will strongly recommend all the students, whether it is an online or offline, I recommend all of you to go through both BLS and ACLS again before you appear exam. Okay. Thoroughly be prepared with your ACLS and BLS. Practice it with your colleagues and do it manually, like as you act, like what you say, how do you check response, how do you activate a emergency system, how do you do a CPR, how do you actually take care of airway. All these skills are essential. You need to get them right. You need to identify all of them appropriately, and all algorithms need to be known to you. You cannot afford to graduate IDCCM without knowing this ACLS. In the same way, airway skills may not be there is an examiner, I may not be able to assess your airway skills, but those are the essential skills which you need to know. Now coming to the preparation of the exam, as we already repeatedly are talking, because we are not able to directly assess the airway skills, we are giving you one of those equipments which are commonly used in this airway management. And we will try to know from your practical use, whether you have used it anytime, how do you use it, what are the indications you are using. We can easily assess whether you have really worked in an ICU, whether you use these equipments or not. That's how actually this goes. And drugs also, most of those drugs, if you talk about antibiotic, if you talk about vasopressors, you talk about antiarrhythmic drugs, all these drugs are routinely used drugs. I have not found any drug which is out of the routine practice which has been given. Sometimes we also get TPNs in the exam questions, and sometimes we get investigations with the CT images and also CT abdomens, and as pointed out, also CTPAs. So all these routine exams or routine practices need to be known. Even as X-ray with endobronchial intubation, a tension pneumothorax, all this can be, and a EDH or intracranial bleed or a stroke. The routine ones can be a part of your exam.
Thank you, sir. For both of you, I think the same thing. One thing, the preliminary thing is, can they interchange between the stations, sir? For example, they go back to the drugs again. Can they go back to ACLS?
See, most of the times we take the flow. We try to give them hints and try to help them in doing. But suppose for a particular student, he couldn't actually identify one and he's taking time. and he wants to go to all the questions and wants to go back. Most of the times the teachers do agree and honor that, but try to answer in a sequential way, not jumbling front and back, front and back. It is always good to prepare well and answer sequentially. The jumping back maybe happens or should be considered as a last option, not a routine or a standard option.
Thank you, sir. Super, sir. This question for you. I think there is a past student, there is a student unfortunately who has failed, and there is a student who has achieved a distinction. What would be the basic difference between three of them on a whole? Can you just let us know?
Yes. First we'll come to the fail student. See, when you fail in the exam, you need not get depressed. When you're giving exam, your knowledge will improve, and then you will become a better doctor. So first of all, we should not feel bad that why they fail me in the exam, and then you will have better scope to perform again, and then you will know better things when you're giving exam. So all these examiners also, we try to update, and then we do a lot of courses. When you try to acquire a lot of degrees. So basically to improve our knowledge, that's all. So when you're giving exam next time, you will become a better critical care doctor. So and if they do mistakes in some stations like ACLS and airway, you cannot pass. And then in the first vignette only, if you're struggling, and then if you're struggling with basic case and these people, they're difficult to pass, and they're requiring a lot of clues to answer in the first vignette, then they will not pass. And an average student will try to answer what he has done in the ICU without much much knowledge, and then without attending much workshops and then mock exams and all. So they'll be answering all basic questions and all. And then when they go to Vignette 2, they may not answer that well. And a candidate who has got distinction, who scored very well, he will maintain good flow, and he will do well in both cases in all the vignettes. And then in the online exam, again, you will not have much time. You will have 5 questions in the vignette, in each vignette, and then you need to answer precisely, and then you have to look at the time, and you cannot waste more time. In the stations also, if you go back, like if you're going back to again ACLS station from the investigations and all, you will be you're wasting time. You will not have so much time. So try to read carefully, and when they're reading they give case scenario also, and then they give image. So they'll be giving some clues, and then you can identify. And the people who get distinction, they answer in the first attempt, and they maintain that flow. And at the time after the exam, both examiners will, when they're talking, so like they say, okay, this candidate has done very well, and then we should give more marks, and he's the best candidate for today's session. So it is the opinion of both the examiners. So if one examiner feels, oh, this candidate has done good, and then the other examiner is not that much impressed, again, you may not get very good scores. So this is my
both the examiners actually mark separately, and then both the examiners send marks also separately to the exam board, that is a college board. My personal way is looking at this. Any student who has to be an extraordinarily good student and distinction has to approach the cases systematically to the question. If somebody asks a question, the etiologies of ARDS, is a pulmonary, extrapulmonary, these are the etiologies, and in a flow, as I said, very precisely, systematically, one after the other, without interruption, and going to the next question. So what we see, we complete the questions one after the other, and the explanation is very clean, clear, precise, to the point, penetrating to the question. So you can make out from the first question itself, this student is extraordinary. You can make out the clarity in their thought process, clarity in their diagnosis, clarity in their differentials, clarity in the way they actually systematically approach step 1, step 2, step 3, step 4. And the distinction student, the extraordinary students, maintains that flow. From that first question, first vignette, first case to second case to the stations. If you uniformly maintain that kind of consistency in your performance and your standards, you know you are going to be an extraordinary. Keeping yourself calm, composed, approaching systematically will make you different. And obviously, you need to be very learned, and you need to prepare adequately, and you need to practice. The practice makes you perfect. You may be having adequate knowledge, but when you are on the exam day and you are not able to express your answers, express your all knowledge, then probably the all knowledge you had may not have any reason to say in their exam. So a distinction student will not just have knowledge, but have adequate practice, will have expressive qualities like systematic expressive qualities, which need to be there, and that need to be consistent throughout the whole exam.
Thank you,
And
sir.
there are questions related to I have performed well, but still I am not able to clear the exam. These are also queries. Should we take those queries also, Deepak?
Yeah, please, sir.
So I have actually come across my own students, sometimes my own known friends and students, sometimes that have done extremely well, and I was not in past. So was there any error in the marking system? Was the examiner was not probably assessing appropriately? These kind of things do always come in the mind of many of our students. Honestly speaking, all the examiners wants you to pass. Okay, many of the times you do not know the blunders, the major mistakes you have done. So you all understand what I mean by major mistake. That is the basic standard things which you supposed to know, which you suppose cannot afford to do mistakes. If you repeatedly do those mistakes, you will be failed. And mind you, all your mistakes which made you fail need to be documented, and those documentation need to be sent to the college board, and the college board will reply you back that what are the reasons for your failure. Okay, most of the students may disagree with that, all those things, but all of these exams are recorded, and they always can be cross verified. So the exam is of a very structured one, and examiners will always try to pass you. Only if they find you very poorly performed students and even don't know the basic, then only you get failed, and you get all those reasons to get failed. And other thing is, suppose there is a difference in the two examiners. Suppose me and Dr. Subbareddy is examiner for you, and I find you performed well, and Dr. Subbareddy finds you have not performed enough to actually clear the exam. Then in those situations, what do we do? Okay, we look at your performance altogether. Okay, you may have not done well on one case, but how have you done in the other cases? How have you done in the stations altogether? So have you done extraordinarily well in other areas? So are we convinced enough that probably the only one area where you actually missed out? In those situations, the both examiners talk to each other, and most of the times, if you have done reasonably well in other areas, they will positively consider you to clear. But if your problem or your performance is consistently poor in other areas, then both of the examiners may find it difficult to clear you or pass you. And then they say probably, yes, these candidates need to go back and prepare well and come back for the next exam.
Thank you, sir.
There are some questions in the chat box.
Yes.
Should we take them?
Yes, sir. Please, quickly. We have a couple of minutes. Shall I read it out for you, sir?
Yes, yes.
So first thing was, do we need to read important literature and clinical trials before the exam? And because that's an extensive literature, how do we do it?
See, as pointed out earlier, you need to know all the landmark papers, okay? Those papers which made an impact on the critical care, which made a change in clinical practice. So sometimes the examiners may expect you to answer, if at all they come across in the second phase of advancement, that which trial actually suggests or in favor of this particular practice. For example, in ARDS, as pointed out, if you want to prone, The examiner may ask you, prompting a question, which study do you think has given a positive results of this kind of phenomena? So we are talking about landmark trials, large randomized trials, or a large landmark trials, which actually give a change in clinical practice. And you may not able to know all the trials, because there is a huge amount of literature every day dumped in. So, but they expect you to know all the major landmark trials which made an impact on the clinical practice.
Thank you. Subha sir, I think one question, can we know our marks?
I don't know, like they will tell you whether
Yes.
you're passed or not. But when you ask for it, definitely when you are giving the best student award and all, so they need to know the marks. And then if you write to IDCCM, they will let you know the marks. And then if you are failing, and then they will let you know the reasons why you're failing. And marks routinely you will get like a result whether you are pass or fail. So later when you ask them, they can tell you the.
I think they get combined marks, and also marks in the cases and stations. Split in each station, split in each case, I'm not sure. But if you fail, you definitely get a reply of the reasons to fail.
Another question, I think in a hurry, someone has answered wrong in ACLS station, but I think examiner has hinted and then he corrected.
No excuses in ACLS, no excuses. So they say ki you have no, and the examiners can, or the student cannot afford to actually do mistakes in hurry also, because ACLS is a situation which is a kind of what is emergency, is a kind of a hurry situation where the whole atmosphere will be charged up. So you have to act with all that maturity. You are expected to be a lead there and do appropriately right things. So what this means? You need to practice. It is not just on the day of exam you go and deliver, but you do it every day in and out in your ICU. You cannot afford to do any mistakes in ACLS. If you have done a mistake in ACLS, you have to come to the next time.
Dr. Deepak, there is a difference between EDIC and IDCCM and foreign exams like IDCCM. In the foreign exams like Australian exams, EDIC exam, they won't ask anything about ACLS. ACLS is not the station. And in India also only IDCCM and the CTCCM has got ACLS station. When you are giving IFCCM, there is no ACLS station there. So the ACLS is compulsory must in IDCCM. So better to do the ACLS course. And then if you're giving DNB critical care, there's one question in the chat box. I am doing DNB critical care, whether ATLS is also required. Yes, if you're doing DNB critical care, you have 3 years time. And then ATLS and ATLS are very, very important and then compulsory. But ATLS courses are very rare, not happening regularly across the country. So when it is not happening, you can attend any trauma life support. And then most of the trauma life support courses are based on your ATLS guidelines. Thank you.
See, most of the societies nowadays are not actually recommending or only asking for AHA guided or certified certificates only. Suppose if your hospital has a ACLS training program or a trauma training program, you can very well attend that. It is all about you knowing the resuscitation protocols. So if it is also your institutional, your organizational, if you do that with a proper learning of flows, that should be enough.
Thank you, sir. The last question for both of you, I think it's a simple question. What are the common books to read and what are the important cases to see? I think you both can.
I think it's very too late to actually guide or suggest a book. We are almost nearing to exam. I think this preparation should be starting for the day one. So we strongly recommend you to read those same standard books of Irwin Rippey, Fink, or the protocol books which we had as a regular way. And nowadays, many of our students also access the online materials also. So this is not the time to select a book. It is too late to select a book. And I will also try to guide those students who only read about 5 or 10 or 15 cases or the books from only case series. Sometimes it may be dangerous for them because they only prepare those students, and unfortunately if you get a case out of those listed cases, then you will be in trouble. So my request or my recommendation to you is try to prepare all the common cases. It is not about appearing this exam. It is just a part of your career. Okay. You have to go back to your ICU and appear every day exam in front of your case. A new case will be a new exam. So I strongly recommend all of you to prepare all the cases in a spectrum way. Yes, you need practice to do a practice, because in exam, you may be knowing the case, but you are not able to express. To do that, you try to present the cases to your seniors. That will help you. And what are the common cases? Many of you are asking, you being a pulmo guy, in a cardiac situation, what are the common cases? See, the common cases which we encounter day in and out in our ICUs, like acute coronary syndrome, patient requiring a primary PTCA, patient requiring a primary or immediate emergency CABG, patients requiring multiple organ supports, including cardiac supports. Those can be a case. Ongoing arrhythmic or rhythm issues in a situation in an ICU. Those can be a cases in a intensive care situation. In a neurology, you both have subarachnoid bleeds, intracranial bleeds, strokes, and probably CSVTs, traumas. These are the cases which come across in the neuro patients. Guillain-Barré syndromes, myasthenias can be a common cases which come across in the intensive care units. In the same way, if it comes to the abdomen, we don't deal with many of the abdominal emergencies, except probably acute pancreatitis, severe pyelonephritis, a perforated bowel, or a gangrenous bowel. These are the emergencies which actually day in and out come to our ICU. So prepare all of them. So don't try to list out a very few cases. So you may able to escape by your exam, but you need to appear bigger exams in your day in and day practice.
Thank you, sir. Pretty wise advice from you. Subha sir, last comments from you before we sign off.
Yeah, the last comments are like, if you do your honest work for 1 year in your ICU, and then don't worry that you're working in like a small hospital, and then you're not seeing different cases. So you're not working in a multidisciplinary ICU, you're working in a respiratory ICU, neuro ICU. Some people will be giving IDCCM from the working in cardiac ICU, and some people will be giving IDCCM after their post MBBS CTCCM. So different variety of students are there. And then my advice to them is you attend the mock exams, workshops regularly, and then when you have time, go and see in other ICUs what's happening. And these are all pretty standard cases. And then like it is very easy to pass the exam, but you need to prepare like with we have some like as Dr. Venkat was clearly telling, we don't have so many neuro cases or so many respiratory cases. We know there are only 4 or 5 neuro cases and 4 or 5 respiratory cases. Abdomen, when it comes to abdomen, so there are 3 or 4 cases, renal 2 or 3 cases. So you go and see these cases in other ICUs, you will definitely clear the exam. It's not easy to fail. It's very difficult to fail in the exam. All the examiners are willing to pass you, and then very easy if you have basic preparation. And definitely all the best to the students, and then you're going to excel. And then so I hope this this webinar is useful for all the IDCCM exam going students. Thank you so much. Thank you, Dr.
Thank you, sir. So dear students, that's it from 3 of us. Thank you all for attending this webinar. I think from the ICCM Hyderabad, I think it is useful for you. So the take home message would be, I think it would be mostly an online exam, as the examiners pointed out, and it would be a time limited one where you need to train yourself how do you manage the time, be precise in what you answer, be clear in what actually the examiner is asking you. And most of the cases, I think it would be a common cases for you and the common scenarios. So when you see an abnormal thing, don't just panic and see what the examiner actually is asking for you. And I think the examiners would be friendly. The ISCCM is friendly for you. We all want you to pass. As I think it was rightly pointed out by Dr. Subbareddy, it is actually difficult to fail you, and no one wants you to fail you. We all want you to be better, and we want you to join as our senior colleagues in the further practice. Thank you so much. Good luck for your exams.
Deepak, I thank Dr. Deepak who taken this initiative and came forward in helping all of you. It is always very kind of you, Dr. Deepak, and I congratulate you and the whole team of ISCCM Hyderabad chapter who has taken this initiative and helping the students. You can see the thank you messages on board. So many students are so glad with your efforts. And also with the association of IDCCM Hyderabad chapter, we are continuing the master classes where some of your questions are, which are the cases I need to prepare? Those are just an example. So you can go through this list of cases which we are trying to bring. We try to brought also the rare cases like trauma, like obstetric cases, like burns cases, like poisoning. The reason for those cases, sir, these are not very common in all ICUs. So I hope these all will help you. The initiative of IDCCM Hyderabad will also help you. I congratulate Dr. Subba Reddy, who is being also the chairperson of IDCCM Hyderabad chapter. And I wish all of you the good luck, best of luck. I know you have all prepared well. You will excel in the exam. I hope our all efforts will help you also in guiding the exam. Thank you.
Thank you, sir.
Thank you for your wishes. Thank you.
Thank you, sir.
Thank you, Dr. Deepak.
Bye, sir.
Bye.